Hi, everyone. Good morning and welcome to the Patient and Family Partnership Hub, our community conversation. I want to welcome everyone. I know there are we have some folks that I haven't seen yet. So welcome, everyone. Happy New Year. We are in 2024. I cannot believe that. And we are well into 2024. So I want to welcome everyone this morning. Let me go ahead and there we go. So once again, these meetings are recorded, so we will send them out to everyone right after we have our meeting, so you're able to watch them again in case you miss anything or you want to revisit our conversation. We have live transcripts available, and we have interpretation in Spanish. So if you have your preferred language, you can go ahead. You will have a prompt up here letting you know which language you would like to choose from. And once you choose that, you're able to hear us or go back and forth if you'd like. So thank you everyone once again for joining us. And some Zoom features. I feel like these sometimes are changing, but for now we have a few constants which are great to have. Again, if you want to chat, we love to read what you all have to say. You can either send a message to everyone, or you can send a private message to myself or Lindsay, who is our other host. Again, the interpretation should look like this. A little globe here at the bottom, and then you're able to choose your language. And then if you need the live transcripts, you can go ahead and click here at the bottom. And the reactions, which I think are always great. If you don't want to unmute yourself, but you want to either raise your hand and wait to, you have something to say, or you want to celebrate someone, or you like what someone said, there are some really great options for some reactions here. And with that being said, we're going to go ahead and start with our agenda. So again, we're going to do a little welcome with everyone. We're going to do our introductions. We are going to, we have Myra here, Myra Garcia, who's going to talk to us a little bit about the HPDP program updates. For those of you that are joining us today that weren't with us back in November, we did a listening session for the HPDP program. And Myra is coming back to share some updates from that. So we're excited to hear from her. And we're also going to go over the community forum. The community online forum is available to everyone, all of our community hub members here, and anyone new that is interested in joining this community. And it's a great place for us to connect online whenever we are not connected during our meetings. So if you'd like to join us, please let me know. I'll give all of the instructions, but I'm going to give a little tutorial. So if anyone is interested in joining, they can join and join us on the chat here. And I'll show everyone all of the different settings and really just step by step what it looks like when you join. So we're going to go ahead and go over that. And I see that I'm freezing a little bit. So Lindsay, just in case you can't hear me, send me a chat or anything, and I am right here.
Yeah, we can still hear you, Lucero, but it might be better to go off camera just in case.
Okay.
Helps preserve your internet a little bit.
Awesome. So I will go off camera for just a little bit, so I will not freeze up on everyone. And right now I'm going to hand it over to Mike.
Thank you, Lucero. Good morning, everyone. Welcome to our first Patient Family Hub, or first Patient Family Partnership Hub community conversation of the year. Thank you so much for taking time out of your day and joining us. Please know that we appreciate and value your time tremendously, and that you are helping shape the healthcare services for all of our LA County community. Welcome again, everyone. Bienvenidos a todos. In a minute, we'll jump into introductions. In addition to our PFCC partners, joining us today is Lasha, who will be helping us today by simultaneous translating our conversation in Spanish, and vice versa. We'll be helping our Spanish-speaking patient family advisors join in our conversation. My name is Miguel Renteria. I go by Mike, and I'm part of the DHS organizational development team. My work evolves on patient experience and supporting our culture of patient-family engagement throughout our health system. What you see here is a slide that is showing an overview of our vision, mission, values, and goals. Our mission is to advance the health of our patients and our communities by providing extraordinary care. Our goals range from transforming our system to provide cost-effective care of the whole patient across the continuum, optimize clinical quality and patient experience, to have a high-performing workforce, and ensure financial viability and supporting of our vision. Today, we're moving towards our mission by advancing on our strategic goal of providing high-quality care and patient experience through engaging your voice to help us in our work. Your voice, your views, and insights are incredibly important to our work, so thank you again for taking time off your day and joining us here this morning. Next slide. And I will pass it back to Lucero. Thank you.
Thank you so much, Mike. And a little bit about PFCC Partners and our mission, vision, and values. Our mission is to center the inclusive human experience of health, reinvent through radical collaboration, be a catalyst for system transformation. Our vision, a health system transformed, one that works with people and through communities as a partner in their well-being. And our values include equity, a brave space resolving the health challenges of today. Inclusion, create belonging for all people and all communities. Diversity, differing perspectives are expected and respected. Collaboration, equitable and shared decision-making power. And solution-focused, acknowledge challenges only to resolve them. So thank you, everyone. And now we're going to go ahead and move on to our round robin introductions. So I will, just like every meeting, I'm going to ask for, if you can say your name, where you're calling in from. And the question this month I was really tempted to ask a question about the new year. So very tempted, but I realized we are on day 16th of the new year. So we have any New Year's resolutions, any New Year plans, anything that comes along with the new year. I think we've all talked about it and we have all kind of resolved that. So I want to maybe change it up a little bit and just ask if you could travel anywhere in the world today, where would you go? So I will go ahead and get started. My name is Lucero Cuevas with PFCC Partners. I am calling from our Long Beach office. And if I could travel anywhere in the world today, I have been on my social media, I have been seeing everyone traveling to Antarctica. For some reason, that is coming up for me. And folks are going on these cruises when they go to Antarctica, and then they step foot on the glacier and they are looking at penguins, and it all just looks so amazing right now. So if I can go anywhere, I would definitely choose a cruise to Antarctica. That sounds a little interesting, but that's where I would go. I'm going to go ahead and pass it to Lindsay. If you can share a little bit about yourself, Lindsay.
Yeah, hi everyone. Good to see you all this first meeting of the new year. I'm Lindsay Kelly. I'm calling in from Sacramento, California, up north, where it is cold and dreary and rainy today. So if I could travel anywhere in the world today specifically, it would be somewhere warm and tropical. I've never been to Jamaica or like the Caribbean islands or anything like that. So I think that would be where I would want to go today, especially.
That sounds amazing on a cold and rainy day.
Yeah.
We've had pretty sunny days here in LA so far. So I feel you for wanting to go somewhere sunny, Lindsay.
Yeah, definitely. And I was just down there for the last couple of days and I missed the sun.
It was nice. It was nice weather, right?
It was really nice. Yeah.
Really nice weather. Awesome. Thank you, Lindsay. I'm going to go ahead and pass it on to Mike.
Hi, Lisa. Oh, thank you. I think Antarctica sounds pretty amazing. But I'd probably go back to Hawaii. I and again just lay out on one of those beaches if I was anywhere in the world today. Yeah, those beaches are pretty magical.
Yeah, definitely the warm weather wins right now. Anywhere warm and nice, that's definitely a winner. Thank you so much, Mike. And I'm going to go ahead and ask Myra, if you can share.
Hi, good morning, everyone. My name is Myra Garcia from DHS Population Health Management, and I am calling from Azusa, California. If I could travel anywhere, like Lucera, I've been seeing a lot of videos, but not in Antarctica, but in Lapland, Finland. So Lapland is kind of like supposedly the Santa town, but it's like very pretty. It looks like a snow globe. It looks like a place out of a snow globe where you can ride the reindeer. There's like a Santa village you can stay. I know everyone's talking about like warm weather, and I'm thinking about cold weather, and you can stay in an ice igloo. So it was really cool. So if I could go anywhere, I would like to take my kids to Lapland in Finland.
Oh, that actually sounds amazing. That sounds great. Yeah, I think we're thinking about the cold weather, Myra. We're kind of stuck with that. Awesome. And Maria Montes, would you like to share? I might be come back.
Perdón, no lo escuché, se ha cortado la voz.
No
Buenos
worries.
días.
Oh, it got cut up.
Yo
Thank
me
you, Maria.
gustaría viajar a París.
I would like to go to Paris. I would like to go to Paris one time and see the Eiffel Tower. And if I could right now, I would go there right now. And Happy New Year's to all. Thanks.
Thank you, Maria. That sounds beautiful. I can imagine right now it would be a beautiful place to visit. So thank you all. Thank you. I'm gonna have to do some planning. And that was one of my, and I don't want to go into the New Year's resolution stuff, but that was one of mine to kind of explore a little bit more. Santa Village sounds amazing. Paris sounds amazing. But yeah, thank you, everyone. It gives us something to think about and to possibly look forward to. So thank you. And I am going to go ahead and continue. And like I said, everyone, we have Myra here, who came to us back in November, and she spoke to us about the Health Promotion and Disease Prevention Program. I'm gonna let Myra, if you wouldn't mind, maybe just talking a little bit about it, just for the folks that were not here back in November. But we had a lot of conversation about the program, and we had some questions for the hub members as to what is their best way to communicate? What is, how much do you know about hypertension? What do you think is the biggest impact for you when it comes to controlling your hypertension or high blood pressure? So we asked the hub some of those questions, but like I said, I have Myra here. Myra, if you wouldn't mind, just maybe give us a little bit of an introduction, and then we can go ahead and talk about some of the updates from that listening session.
Sounds good. Thank you, Lucero. I actually, like Lucero mentioned, back in November, and even before November, I presented first here in the community hub before the listening session about the HPDP program, the Health Promotion and Disease Prevention Program. And we talk about, like, our aim is really to start with hypertension and help the patients who are diagnosed with hypertension have that have that condition controlled, have their blood pressure controlled. So when I remember Maria being on that call, and I think there's a couple more patients on that call, the first one that I attended in this group, and the common theme was that there's a lack of understanding or misconception about hypertension or about blood pressure or about the importance of adhering to medication or medication compliance. And then, like what Lysara mentioned, sometime in November, I attended a listening session again with patient, and then asking those questions like, we are developing this program, what will be really helpful to you as a patient that we should consider in developing this program? We asked several questions like, what's their understanding about blood pressure or hypertension? What will be helpful to them? If we need to communicate with them, what are the most preferred way for us to communicate with a patient? And again, from that conversation, the thing that keep coming up is more on like information, having information. There's a desire for knowing about what are the resources available in the community and in the facility itself. So from those feedback from the first listening session, highlighting about patient education, from that meeting, I went back to the group, and what we had implemented back in October, I think it was in October, is that all patients who are seen in nurse visit clinic for blood pressure check, any patient that comes into clinic for blood pressure check with a nurse visit should receive patient education material about hypertension at minimum. So there is a standard patient education material that will now be attached to the patient's after visit summary. There's a patient education there. At minimum, it talks about what is hypertension, what are the things that they have to look for, how can they manage it in a simplified version. And in addition to that, if the nurse identified there is a need for additional instructions, such as, let's say, weight management or physical activity, they can also attach those patient education material in addition to that kind of like hypertension overview patient education material. So that's what we implemented based on the feedback that we received from this group. So again, thank you so much for giving us that feedback and helping us realize what is needed. I remember one of the comments last time was, most of the time patients tend to get the information from their friends, from their neighbors, which may or may not be accurate and correct. So now we are we have that patient education material that is attached, that is reliable information, and the nurse will go over that with you. So right now, any patients who are seen for any visit related to blood pressure should receive that patient education material in their after visit summary. Then in November, during the listening session, one of the things that kind of like pop out is the awareness of the resources we have available. One of the things that came out was there was a patient that mentioned that she's aware of the community resources, but she would like to have kind of like a health education or somewhere in the facility where they can connect and they can get that training or instructions or guidance on managing their blood pressure, whether it's weight management or anything related to blood pressure. From that feedback, we are working with our health education team. So majority of our sites have health education team already in the facility. So the two sites where we rolled out, San Fernando Valley and Mid Valley Health Centers, have health education team. But it sounded like from the listening session last time, it sounded like not a lot of patients are aware that there's health education team within the facility that they can be referred to. Like the nurse or the doctor can refer them to them. But what we are working now with the health education team is finding a process where patient can self-refer themselves. So first is like, making sure that patients in the facility, in that clinic, is aware of that health education resource available, like making that awareness. We're working on how we're going to advertise that so more patients are aware that that is available. And then second is how can we make it easier for patients to be connected? So instead of, having to see the doctor first before getting referred to health education team, or we're trying to make a process where the patient can self-refer themselves to the team. So the health education team, basically what they do, they have group sessions where you can attend. It's 3 or 6 sessions where you can attend, and it talks about your nutrition, the weight management, anything particular to like how to live healthy. But if that does not fit you, let's say you cannot do 3 sessions on a set schedule, they also have an option to do a one-to-one session where a health educator will talk with you. They'll set up an appointment with you, and based on that, they'll create a curriculum specifically for you on how they can help you achieve your goal, whatever it is. It is not only particular to hypertension, but since our focus right now is hypertension, we're trying to start with that. So again, all of this progress and updates and changes that we are doing, it's all because of the feedback that you guys gave us. So thank you so much for giving us that feedback, because then now we know what we need to work on, what we need to really leverage on. And having that realization of the patient's perspective really is very helpful in doing this project, because we get to consider those. So hopefully you'll see that when you go to your clinic. Right now it has to be related to hypertension, but as we build on it, it'll be expanded to other chronic condition. But hopefully when the patients go for their appointments related to blood pressure, they'll see those changes, at least with the patient education, since it sounded like a very important factor for the patients. And so yeah, that's all the update that I have.
Thank you so much, Myra. That's that you brought so much insight and so much new information for us. And before I open up for questions, if that's okay with you, I do have a question myself. I know you talked about it's starting the process of a self-referral. So if I understand what it looks like for a patient, it would be maybe someone is, being scheduled to see either a nurse or their physician, but they already know they are struggling with the hypertension. They can then say, you know what, I know I have my appointment this day at this time, but I'd like to get some education first. They can, so the process is they can go ahead and refer themselves and join some of these classes before they see their physician or their nurse?
Well, we would like for the patients to still, keep their appointments with the provider or the nurse. But let's say that patient, like, no, yeah, yes, I have an appointment with my provider, I have an appointment with my nurse, but you know what? I do wanted to get more information about health education, kind of like similar to one of the patient mentioned on the listening session, where she knows, like, I know that it's important for me to control my weight, but I need to know how to do it, or I need more guidance on how to do it. Like, though the provider or the nurse can tell you, like, these are the things that you have to do, but having connected to a health educator who can help you like understand more on what you need to do and hopefully follow up with you, and have that kind of like education piece more integrated into the journey of the patient. And that's what we're trying to do. So like the patient can go like, yes, I need help with my weight management. I can, the idea is that they can go to the desk, or there's a phone number that they can call and schedule an appointment with a health educator. So yeah, but then the piece of the provider and the nurse will still be in there, but the health education piece will be in addition to that.
Right. Okay. That sounds really great for patients. And you said right now it's in 2 locations, correct?
So the HPTP program rolled out into health center groups. That's the San Fernando Health Center, which includes San Fernando Valley, Clinic, Glendale Clinic, and there's one more, Mid-Valley Clinic. And the other health center group that we rolled out for the program, HPD per program, is San Fernando and San Gabriel, which is El Monte and La Puente.
Yes, yes,
So
yes.
those two health center groups, which technically have like 5 clinics under them, we rolled out the program with them. They do have health educator team within that, but right now we are still working on the process on how we can make it easier for the patients to self-refer to those sites, because right now the referrals pretty much like from the provider. Like the provider has to refer the patient to the health education team, or the nurse has to refer the patient to health education team. So we wanted to create a process where the patient can just self-refer themselves to those sites, to the health education team.
That sounds that sounds amazing, and an amazing progress for patients, especially with like you said, hypertension. Sometimes the education piece is just as big as, you know, actually getting to see their provider and getting medication if they need it. So thank you so much, Myra, for bringing all this information to us. I do want to open it up for questions if there are any. Before we go ahead and move on. And I do have some, just a few quotes from the hub. And I think, Myra, you touched on all of these points already. So thank you so much for that. But this is just some of what the Patient Family Partnership Hub said during the November listening session. But I do, if there are any questions, please go ahead and unmute yourself if you have any questions for Myra.
This is Lindsay. I don't have any questions, but I just wanted to thank you, Myra, for coming back to the Partnership Hub and providing these updates. And it's really clear that, you know, you took what you heard from the patient family partners and are, you know, it's a process, but implementing some improvements to the program and making it more accessible. So I think that's really, really exciting to hear, and just appreciate you providing that update.
Yes, thank you so much, Myra. Again, if any questions that come up for Myra, please let us know. We can go ahead and forward those questions to her. And actually, with that being said, that kind of leads us to the next part that I wanted to share with everyone today. And that is just going over our Patient Family Partnership Hub Community Forum. So just as we talked about, we're in our meeting here, and it's 1 hour, but you know, something might come up later that you want to share with us, or that we want to share with the community as well. So I wanted to go over really what this community forum is for, and how you all can use it, and how, you know, we can continue to share information here and connect with one another. One of the great things about the forum is that it's accessible to everyone at any time. So if we are, you know, we have our Partnership Hub meeting here, but like I said, if something comes up later, we get information that we want to share with all of you, but we meet once a month. That information will be readily available in our forum. So think about it as a way that you can connect to other members, you can connect with leadership, you can connect with the entire community here in this space. So I want to share, I know some of you are already enrolled, and then some of you are completely new to this. So I want to just start from the beginning and show everyone what it looks like from kind of beginning to end, and then open it up for questions if we have any. So I will go ahead and get started. I started this with thinking, well, if I am new and I am getting our flyer, I'm getting information about the hub, and I would like to enroll into the forum, what would that look like for me? Okay, so I went ahead and just started from the beginning. So once you click on our link, and I have that, I usually share the link to the forum when we are sharing information with everyone weekly. And if you haven't signed up, something like this will pop up. Actually, exactly this page will pop up. And it will really just prompt you to sign up. It's a really easy process to sign up. You really just need to put in a username. It can be your name, you can use a nickname, you can use any name that you would like us to refer to you by, and your email address and just a password here. So once you go ahead and you log in and you put your information that's required here, it will prompt you to another message. And right here to your left, it's going to say, thank you for joining the community forum. To begin using your account, please verify your email. So you will get an email right after you enroll that you'll see it in your email, and it will be titled verify your email address. So once you go ahead and receive this message, you can go ahead and click here where it says verify your email address. Once you do that, it takes you directly to the community forum, and it will provide you with this message. It says your email address has been verified, but your account is still pending approval. You will be notified via email once your account has been reviewed. And this is just a way for us to just make sure this, and you know, our folks joining the hub, that we have their email address, we connect them to our Google group so they're able to get messaging from us. So it does take an approval process, and that process really just goes to me. So I go ahead and get a notification saying that we have someone new that wants to join the forum. Once that person gets approved, and I will show all of you what that looks like. It says you are now ready to join the community forum. So you will receive a message such as this one that says your forum has been approved. And it gives you the link to join the discussions. So if you can, you know, from what you can see, it's not a lot of process. It's basically just putting your, creating a username, putting in your email address, and then just getting the approval, which doesn't take a long time, but if it's something that you're doing over your phone, just make sure you check your email and you'll have the approval, you'll have the link there for the forum. Once you're all connected to the forum, this is the exciting part, at least for me. This is what, you know, I get excited about, is what does it look like to someone that's new to us? What does it look like for someone that hasn't really explored the forum very much? And you get you hop right into everything. So this is our main page, and here you will find, I have it here labeled as the latest. So it's really just the latest information we have, and what is in our forum right now. So just by looking at it, you can see we have quite a few posts. I try to post here as much as possible, meaning that if we receive new information or something that we want to share with the hub, it's here. So if you, for example, if you look here, we have an upcoming listening session, which we had with Myra. So that information is here. It gives you information on how to join, just in case, right? So if there's an email that you know you missed from us, or you know life happens and you know it get lost, things get lost in our email, you can hop onto the community forum and see, oh, there's a listening session coming up. When is that? And it gives you all of the information there. It gives you the login for our next meeting. So that's something that's really great. I'm going to go ahead and stop sharing my screen because I want to share kind of like a live screen with all of you. Thank you, Lindsay, for posting the link. And Lindsay has posted the link, and I will also share it again once we are done with our meeting today, and you will get a follow-up email from me, and that will also give you the link to the forum. But here we go. Are you all able to see my screen? I believe so, right? Okay, so for example, I just want to share this with all of you. again, we have our Patient Family Partnership Hub meeting once a month, but there's tons of information that we can share with all of you throughout the month. So if there's anything you want to join on discussion in, if there's anything, for example, sometimes we have surveys, or we have again, our listening session that came up this past November. Oh, one more thing, another thing, the national, we had November is National Caregivers Month, so we had a post about that. I'll go ahead and click on that just so I can show all of you. And it was basically giving information about being a caregiver. So we have not only resources here, but we had just some centers, family caregiver support services throughout LA County. So again, we have that information there, and you all are able to join in the comments as well. For the listening session we had information here to log in, and what the HPDP team was interested in doing. And again, we just heard from Myra, so we have lots of information about that. But this was back in November. We have just a reminder here for our meeting, right, for December. And again, this is an opportunity for all of us to join in. Here is just one for the new year. And one of the questions I asked was, again, we're not, this was 13 days ago. This was the beginning of the new year. So we were still asking all of the questions of all of the questions of what we were planning for the new year. And just a quick, Lindsay, were you able to see me switching screens and pages? I've been switching back and forth, but I don't know if you all can see that. Uh-oh, I hope I'm not frozen. All right. I hope I'm not frozen. If y'all can hear me. Mike, can you hear me?
Oh, sorry, Lucero.
Yes, Lucero, we could hear you.
Okay.
Triple muted.
No worries.
Can you switch the screen one more time? I wasn't sure.
Yeah, let me go ahead and I'm gonna stop sharing. I've been going back and forth on screens, and I just want to make sure everyone can see. Here we go. I have the Happy New Year post, if y'all can see that.
Yep.
Awesome.
See
Okay.
that, yeah.
Thank you so much. So again, we started off the new year, so I just put up a question that anyone can join in. What are your goals for 2024? What are you excited about? What would you like to see from the Patient Family Partnership Hub this year? So again, we have conversations, whether it be about what we want to see, whether it be about what's coming up, whether it be what is the focus on, what is a specific focus we have for the hub. We often have surveys, we have sharing information. So this is really a great place for anyone to join at any time and just either look up information that might be important to you or join in on the conversation. A lot of times the community is very well versed on what's going on, and they let us know, right? They give us information about what's coming up, and we love to hear it and then share it with everyone else. So it's a great place to have us, centralized information. So again, it usually goes out in an email as well, but as we all know, things get lost in our email. This is just one central location for everything hub related. So I want to welcome all of you to try it. If there are any questions, please, especially with the registration, please feel free to call us here in the office, send me an email. I will more than gladly walk all of you through the process, or anyone that's interested in joining us. But if there are any questions, I will go ahead and open it up for questions if anyone would like to ask, or anyone has anything that they want to share.
Lucero, can you actually walk through how to reply to a post?
Absolutely. And I will do it here with this first one because I actually replied myself with my New Year's resolutions. So for this one here, if you click on a post, you have all of the information that we would like to share with you. And then down here in the bottom, it's also in Spanish. So everything that we post is in English and in Spanish. And then down here in the bottom, it has the write a reply option. So all you do is you click here and you type away. And if you can see here, I kind of replied to this post. I shared my personal goal is to have more adventures with my kids this year. And for the Patient Family Partnership Hub, I am most excited to bring new voices and topics to the community. So if anyone from our hub wants to reply, they're more than welcome to click the reply here. And everything they type up, hit reply, and it is then posted for everyone else to share. So if we're sharing thoughts, information, is a great opportunity to have other voices as well. So if you reply and it's something that, we're, talking about, for example, let's just say our listening session that came up, and I'm using that example a lot, Myra, because you're here. So if we want to share anything about that, we can use the hub to share information. If you have any questions, anything that comes up for you, especially for the listening session, we asked a ton of questions to our hub members. And a lot of them, everyone answered to, they gave so much insight. But I feel that sometimes there are things that we miss. So this happens to me all the time where, if I am with someone and when we are going through something like this, I will think later, oh my gosh, I should have brought this up, or this came up for me. And it was after we had our meeting, it was after our hour-long conversation, but I want to share it and I feel that others will benefit from it. This is a great place to do that. This is definitely a great place. And again, this is something that you can share with others as well. So if we have the link, you're more than welcome to share the link with others in the community. But then also, again, feel free to reach out to me and I can walk anyone that's kind of starting this process through this. It's a great place for us to connect and to stay connected throughout the month. Thank you so much for that, Lindsay. I forgot about that part of replying and what that
No,
looks like.
all
Are there,
good. All
yeah. Are there any other questions as far as our community forum as far as this goes? We have quite a few posts and there will be more throughout the year. So I think something that I do plan on doing is anytime you hear from me during our, I send emails quite often. I will send I will include the link to the forum. And make sure you all know that this information is here and it's accessible with a few clicks. Especially if you're already enrolled, it's really just one click. If you still need to enroll, like I said, we walked through a little bit of it, maybe two clicks or so, just to get you all set up. But this is a great place for all of us to connect. And
Yeah, thank you, Lucero. I agree. And I might also ask Maria or others, like what's the best way for us to use this forum? What are some topics or conversations that you would like to see here? Just starting to kind of brainstorm some ideas. I know Lucero has done a great job of adding tons of information here, resources, starting conversations, but also just want to make sure that what we're posting is relevant to the community. So any other ways or thoughts or ideas on how we can grow this community through the forum as well would be definitely welcome.
Thank you, Lindsay. And if anything comes up for anyone, again, just like Lindsay said, we're always looking to make sure that the information we share and the information we post is relevant to the community and those that are receiving the information. So for anyone here, for Maria, if there's anything you think about, later on, definitely let us know. We are always welcome to receiving that information and the thoughts and ideas of our hub members. So if any of that comes up, please feel free to let us know. But yes, I am very, very much excited to include this in a part of our, communication. And this has been a part of our communication for some time, but I think having this session and everyone, all of us learning together will definitely, help with the participation, definitely. And with that being said, oops, let me go ahead and stop sharing. I have to go back to my slides. Let's see. Here they are. All right. And just as we are speaking about our forum, I do want to make sure I bring up the next month community conversation. So next month we are meeting Tuesday, February 20th at 10 a.m. at the same time. Again, I will post this on the forum as well, so you will see all of this information as well and in an email. So if any questions, we have the link to sign up via email. We have it in our forum. And again, you can always reach out to me via email or our office here at PFCC Partners. But if there are no more questions, I want to thank Myra today for joining us and sharing all of this information with us and all of the updates. It's really great to see. And also, Maria, thank you so much for joining us today. We truly appreciate you joining us. And everyone here, definitely, we hope you have a great rest of the January. We are midway through January. I cannot believe that. And we will see all of you. Gracias, Maria. We will see all of you next month.
No, a ustedes, muy amables. Hasta luego.
Gracias.
Thank you to all of you guys. You've been very kind.
Thank you.
Thank you.
Thank you, everyone.
Thank you. Have a great one, everyone. Bye.
Bye, you guys. Thanks so much. Bye-bye.
Bye.